1. Coronary artery disease. The deadliest disease for modern humans currently is coronary artery disease, also known as ischemic heart disease. When a person's blood vessels narrow due to damage, they are at serious risk of heart disease. Symptoms include arrhythmias, chest pain and heart failure. You are at risk for heart disease if you have one or more of the following factors: high blood pressure, high cholesterol levels, smoking, family history of coronary artery disease, diabetes, being overweight. Fortunately, due to improved science, medical care and education, death rates due to coronary artery diseases have declined, even though it remains the #1 killer. Coronary artery disease can be avoided by maintaining a lifestyle that encourages good heart health. To decrease your risk, follow these tips. Exercise regularly, maintain a healthy weight, eat a balanced diet low in sodium, and high in fruits and vegetables, avoid smoking, drink alcohol in moderation too. A stroke can happen when an artery in the brain gets blocked or leaks. Your brain will then be deprived of oxygen and cells will begin to die within minutes. Symptoms of a stroke include numbness in parts of your body, trouble walking or seeing, and confusion. It's possible to recover from a stroke, but if left untreated, it can cause long-term disability. Getting treatment within 3 hours of experiencing a stroke lessens the likelihood of long-term disabilities. But according to the U.S. Centers for Disease Control and Prevention (CDC), while 93% of people know that sudden onset of numbness is a sign of a stroke, only 38% are familiar with the other stroke symptoms. Hence, stroke remains the leading cause of long-term disabilities. Risk factors for stroke include high blood pressure, family history of stroke, smoking, especially when combined with oral contraceptives, smoking, diabetes, brain aneurysms or arteriovenous malformations, age and gender. Some risk factors of stroke can be reduced with preventative care, medications and lifestyle changes. In general, good health habits can lower your risk. These include controlling high blood pressure, exercising regularly, eating a healthy diet low in sodium, avoiding smoking, drinking alcohol in moderation. 3. Lower respiratory infection. The flu, bronchitis, tuberculosis and pneumonia are sources of infections in your lungs. Viruses and bad bacteria enter your airways, causing key symptoms like coughing, breathlessness or tightness in your chest, and wheezing. If left untreated, lower respiratory infections can lead to death. To guard against respiratory infections, it's advisable to update your flu shot annually. Avoid spreading or picking up bad bacteria by washing your hands frequently, especially before eating and touching your face. If you catch an infection, stay at home as much as possible to allow yourself a chance to rest and clear the infection more quickly, as well as to avoid infecting others. 4. Chronic obstructive pulmonary disease (COPD). This condition makes breathing difficult in the long term. Emphysema and chronic bronchitis are some of the most common types of progressive COPD. An estimated 64 million people were recorded as living with pulmonary diseases in 2004. Risk factors for COPD include smoking or exposure to secondhand smoke, exposure to lung irritants like chemical fumes, a history of respiratory infections as a child, family history of COPD. The progression of COPD can be delayed with medication. Getting treatment quickly increases your chances of successful treatment. You can also prevent COPD by quitting smoking, avoiding secondhand smoke and other lung irritants. 5. Respiratory cancers. This disease includes cancers of the bronchus, trachea, lungs and larynx. Factors that lead to developing this type of cancer include secondhand smoke, toxic particles, smoking, mold in the home and other environmental toxins. A 2015 study reports that respiratory cancer accounts for about 4 million deaths annually, especially in developing countries. Although those who smoke are the most at risk for developing this condition, it can happen to anyone. Family history and regular exposure to environmental poisons also play a role. The most obvious method of prevention is to stop smoking, or not starting. Apart from that, there isn't much that can be done to specifically arrest the development of this disease, except to minimize your exposure to a poisonous environment. You can also use an air purifier in your home and office, and wear a mask when going outside in poor air quality conditions. Early detection can save you from experiencing the very worst symptoms of respiratory cancer.